So today we have an interesting case of a 63-year-old female with the right ankle joint arthritis. She has pain, instability since 6 years and she's walking with a limp. We can see there is a visible and marked osteolysis in the talocalcaneal interface which gave her the instability and pain. Also due to her weight bearing status, she has developed a distal fibular fracture. The foot looks very everted due to the extreme valgus angle. Also the deformity is very evident. You can see how much is the instability here. So about making portals, firstly we will mark the medial malleolus, then the lateral malleoli, coming to the dorsalis pedis and the ankle joint. The arbitrary ankle joint will be somewhere here. Now that will be our anterolateral, and around here it will be our anteromedial portal. We have gone in from the anterolateral portal. And now we are into the talotibial joint. So left side you can see there is a fibula. On the right hand side you can see there is a taladome, and above it is a plafond, tibial plafond. So we have got our burr inside. This is a high frequency burr, arthroscopic burr. You can see there is a arthritic joint, talofibular joint, which is very lax. So we are going to denude all the cartilage of the talardome, distal tibia and the fibula. So the question is, why use arthroscopic burr? In conventional ankle fusion surgery, we take out the lower end of the fibula to expose and denude the ankle joint cartilage, also to get the compression. Using arthroscopic burr, it preserves a lot of native bone which is less invasive, lesser wound complications, and faster union due to the compression mechanism of the TTC nail. After putting a guide wire from the normal mechanical axis, we have put an entry reamer, and we can see and check it in AP as well as lateral view if our nail is going through the center. Make sure you have removed all the fibular attachment before proceeding to the nail, because fibula needs to glide down inferiorly so as to get a compression at the site. So the TTC nail is pretty much like any other retrograde nail, has a proximal as well as a distal locking mechanism. Additionally, it has an extra compression mechanism to get the compression between the bare bone interfaces. As a good number of soft tissue is preserved, also the bone is preserved. There is an early fusion at the ankle joint which gives a stable and pain-free ankle joint.